BMB Connect. Today we have with us Dr. Dhiman Kahali, star of BM Birla Heart Research Centre, who will be giving us insights on hypertension and how hypertension becomes a risk factor for heart diseases. Usually, hypertension is defined as high blood pressure, which is usually above 140 by 90, and is considered severe if the pressure is above 180 by 120. High blood pressure often has no symptoms. Over time, if untreated, it can cause health conditions like heart disease or even stroke. In our first segment today, Dr. Dhiman Kahali will be telling us about the causes, treatment options available for hypertension. I welcome you, sir.
Thank you.
You could just expand on the topic.
Namaskar. Hypertension means high blood pressure. Tanya has just now told that at 140 by 90, American Heart Association and American College of Cardiology and also JNC 8, which is the last information from the American cardiologists regarding the level of blood pressure, they have defined 140 by 90 as the cutoff point above which we should tell the patient is suffering from hypertension. And if it is between 130 by 80 to 139 by 89, it is pre-hypertension. So, we know this is the definition in US. But across the Atlantic, in Europe, according to the European Society of Hypertension, just last Saturday we had a meeting with them, long meeting, and during the European Science Congress Society of Cardiology meeting, and then we had formulated with European Society of Hypertension that 130 by 80 is the cutoff limit. So if someone's blood pressure is more than 130 by 80, we tell patient is suffering from hypertension. About 15 years back or 20 years back, the definition of hypertension in any international textbook of cardiology was 160 by 95 millimeter of mercury. Then why such drastic change in bringing down the level of blood pressure to be normal and hypertensive level? So from 165 by 95 to 130 by 80 is a long journey. And even now, as I have told, that 140 by 90 is the cutoff limit according to certain societies like American College of Cardiology and American Heart Association. But this has not been done arbitrarily, but because of the fact that at this level, 140 by 90 millimeter of mercury, the people found from the life insurance data, because they have got a data which is true and which is reflective of the things occurring in our society. That showed that in patients with blood pressure 160 by 95, the incidence of complications like cerebral stroke, heart attack, heart failure, eye complications, peripheral vascular complications, cerebrovascular complications in the form of stroke, either hemorrhagic or non-hemorrhagic stroke, the incidences was much large than it was. It was almost 200% more in 160 by 95 as opposed to 140 by 90 millimeter of mercury. Now another trial, SPRINT trial, which was published few years back, say 5 to 6 years back, in one of the European Society meetings, and they have shown, this investigator group, trialist groups of SPRINT trial have shown, no, 120 by 80 millimeter should be the cutoff limit, because above that the complications are more. But the way they saw the blood pressure is something different from what we practice in our regular and normal practice. So what is it? SPRINT type of blood pressure measurement. First we learned about all these terminologies. That means the patient should be in a quiet room for 10 to 15 minutes. He or she will be not in the doctor's chamber, but in another chamber, antechamber, and he should be totally relaxed. And then his blood pressure should be seen 3 times, and a mean of 3 blood pressure should be taken. But in our practice, we don't see the blood pressure like that. If somebody's blood pressure is very high, we see his or her blood pressure after 15 or 20 minutes and see whether it was an office reaction, means the blood pressure was high because of meeting with the doctor, meeting with a separate environment, that causing some sympathomimetic action, some release of some hormones, and that causes the blood pressure to be high. So we saw it and we defined that blood pressure should be below 130 by 80 millimeter of mercury. I am also a member of the Indian guideline for the hypertension. We have also kept it like that. So anything more than 130 by 80 is now high blood pressure, and we should try to keep it below 130 by 80. And any blood pressure more than 180 by 100 is severe hypertension or accelerated hypertension. And as Tanya has mentioned, that hypertension is a silent killer. Why? Because the patient has not much of symptoms or signs due to hypertension. So we are unaware of the disease prevailing on us. So what happens? The person goes for some interview or for some medical test or for some operation or for routine checkup, and then suddenly the doctor decides that the blood pressure is at a hypertensive level. He finds it and tells the patient. So for the first time, he or she knows that he or she has been suffering from hypertension. So that is the genesis in majority of the patients. Now, is it totally asymptomatic in all the patients, 100 out of 100? No. Ladies and gentlemen, it's not like that, and many patients are also symptomatic. So we should know about the symptoms just to be able to catch those group of patients and to treat them well. And we as doctors tell that at the age of 10 or 12, everybody should have their blood pressure checked once. Because many of the youngsters, many of the adolescents, or many of the childs, they have high blood pressure. So that can be diagnosed and that can be treated, because they are the future of our country. They are the future generation of our country who will be building the nation by going to different professions. And as Swami Vivekananda has told, a healthy nation depends on the health of its people, on the nationals. So that's very, very important that we should have very good health. So what are the symptoms of hypertension? Number one, that is headache. Headache is a very common symptom. So the patient complains, sir, after coming to the house in the evening, this was not present previously. I get headache in the frontal region. Always it is not the symptoms. Many times they complain of pain in the back of the neck. We call it as nape of the neck. So they complain of pain in the nape of the neck. So either headache or pain in the nape of neck. And then sometimes they tell that we are suffering from dizziness and vertigo. That's a very common manifestation of hypertension. Then after checking the blood pressure, it is found to be 190 by 100 or 110. And the patient definitely tells us, sir, I have no hypertension, In my house I check it and it is 110 by 70. Rather low blood pressure I am suffering from. Because they also don't want to accept the fact that they have been suffering from high blood pressure. Now the next question is that, has it got any symptoms like palpitation? Yes, sometimes it is. Shortness of breath on exertion or at rest? Yes, it is. And sometimes it may be an acute manifestation like cerebral hemorrhage, cerebral stroke. The patient cannot utter words, he is speechless, and one side becomes paralyzed or one side becomes weak. And that is the common manifestation of cerebral stroke. Or the patient suffers from acute heart failure and the patients complain of severe respiratory distress. So these are the acute manifestations of high blood pressure. And the patient has got sometimes severe chest pain, retrosternal. And this is because of aortic dissection. This is an extreme case. And the blood pressure you find to be very high sometimes. So these are the various manifestations of hypertension. And it can produce chronic symptoms, as I have told you, like headache, pain in the nape of neck, pain in the front of the chest, shortness of breath on exertion, palpitation, sudden loss of consciousness for a while, that is a TIA, transient ischemic attack. So these are the various manifestations of hypertension. And acutely, they can present a severe respiratory distress with severe left ventricular failure. Or he can have a heart attack, or he can have a cerebral stroke with unconsciousness, with one side becomes paralyzed, he is unable to talk, or even if he talks, he cannot get the meaning of the person who is talking to him. So these are extremes of situation, and these are manifested as cerebral stroke, either cerebral hemorrhage or cerebral non-hemorrhagic stroke. So these are the various manifestations of high blood pressure. Now if the blood pressure is 150 by 100, we call it as up to 150 by 100, we call it as mild hypertension. But if it is above that, 150 by 100 to 160 or 170 by 100, we call it as moderate hypertension or grade 2 hypertension. Nowadays we call it as grade 1, grade 2, etc. And if it is say 220 by 130, as Tanya told at the outset, we call it as accelerated hypertension or severe hypertension, and they should be treated immediately, urgently, and preferably in a hospital setting.
So,
Now
So like basically, what is the main cause of hypertension?
That's a very intelligent question, I should tell. What is the cause of this disease? It's so prevalent. Let me tell you that all over the world, several crores of people are suffering from hypertension. In India, above the age of 40, 50% of the patients are suffering from hypertension. And above the age of 20, 20% of patients are suffering from hypertension. So this being the severe incidence among the population, hypertensive population, what is the cause of this disease? Very intelligent question. Number one, it is idiopathic, means we don't know the cause. We call it as essential hypertension.
Okay.
So that is the commonest cause of hypertension, and in 90% of the patients we find that essential hypertension is the cause of hypertension. Where we do not find any cause for the hypertension, we call it as essential or primary hypertension. So this is hypertension as such, and we don't know whether any disease is causing it. Now coming to the secondary hypertension, means when there is a cause of this high blood pressure. Number one, the kidney cause, very common. So chronic pyelonephritis is a very common entity, and for that somebody can have this disease, hypertension. Acute glomerulonephritis, chronic glomerulonephritis. Then there are other kidney disease like polycystic kidney. There is a cyst inside the kidneys, multiple cysts, so we call it as polycystic kidney. Similarly, chronic kidney disease with renal failure is a very common disease. Similarly, acute renal failure is a common cause of severe hypertension. So kidney disease, the artery supplying the kidneys, if it gets stenosed due to by any chance, we call it as renal artery stenosis. That may cause hypertension. In children, because of coarctation of aorta, the main vessel supplying the whole of body, taking blood to the lower extremities, kidney, etc. But if there is some constriction, that can cause hypertension, which is seen in the upper extremities, and the hypertension may be very severe, but this is a cause of secondary hypertension, and if we relieve the coaptation in the aorta, the patient gets well. Similarly, these are the congenital causes of hypertension. Now there is another cause, hypothyroidism. Hyperthyroidism can cause hypertension. Similarly, the peripheral arterial disease, the Takayasu's disease and etc., they can also produce hypertension. The arteritis, this group can also produce hypertension. So there are various other causes like tumor in the adrenal medulla that can cause. Sometimes we call it as cone syndrome, where it is associated with low potassium level. So whatever antihypertensive drugs you give, the blood pressure will not come down unless you give some spironolactone, which is specific for this cone syndrome, which will correct the hypokalemia, means the low potassium, and which will bring up the potassium to normal level, and also which will reduce the blood pressure. A single drug which can reduce the blood pressure. Of course, nowadays, if the blood pressure is 150 by 95 or 160 by 95, we take the advantage of adding one drug to another drug. Like telmisartan with amlodipine is a very common combination which takes care of the blood pressure with minimal side effects. Because I am very apprehensive that if a patient gets side effects from the drugs we use in hypertension, it becomes very problematic. He will simply discontinue. As such, people discontinue some of the drugs because of the fact that the patient don't want to continue the drug for years after years or months after months. And as a result, they discontinue the drugs. So that's a major problem with hypertensive population. And sometimes we give the medicines, one pill containing three drugs, three molecules, like telmisartan, chlorthalidone, and amlodipine. We give as a single tablet. And sometimes we give it in the evening. What is the timing? A common question asked by the patients is, at what time should I take the drug? Normally, we give the drug in empty stomach. We used to give. Till now, in Eugene Braunwald's textbook of heart cardiology, it is written, it should be given in empty stomach, preferably the first thing in the morning. He also tells that if somebody gets up to pass urine, it should be given at that time, so that the action is complete, the absorption is complete. But now, the majority of trials have shown that, these are all recent trials, that the antihypertensive drug should be given in the evening. So for the last few years, I have changed my practice, and being enlightened by these newer trials, I am also giving these antihypertensive drugs in the evening. If we have to give multiple drugs, then we divide it, give majority of the drugs in the evening in empty stomach, and a very few of the drugs in the morning. And we should have to notice that the patient doesn't get non-compliant to the drugs. That's a major problem, I tell you. Many patients stop the drug, so don't stop the drug. And adding on that drug therapy, more important is lifestyle modification measures. Just in the afternoon, I was interviewed by several TV channels and also news media, newspapers, that what is the cause of heart attack and death in this 40-year-old gentleman who was a great actor in Mumbai.
Yes.
Right now, I have a patient, so I told that very active lifestyle, very competitive, very dynamic, we call it as type A personality. They have a lot of anxiety, lot of tension, and everybody wants to be number one in the industry. Everybody wants to be Amitabh Bachchan. That should be. I am not criticizing him. That should be the drive. Everybody should follow the best. Everybody should try to be an Amitabh Bachchan, and that is the problem, That creates anxiety, that creates competitiveness. The patient becomes hyperdynamic. He works 16, 17 hours a day, and then very much anxious. He doesn't know about the future, because in the future another two very good actors have got some contracts which he was to get. So this sort of complicated mental condition, and lot of anxiety and tension causes hypertension also, besides heart attack, besides coronary artery disease. And as we know, hypertension, because of the shear stress at the origin, at the bifurcation of the coronary arteries, produces plaques over there and causes coronary obstruction. So these are the major complications of hypertension. Number one, cerebral stroke in the form of hemorrhagic stroke or non-hemorrhagic stroke or TIA. Each type of complications can be there. Number two, the cardiac complications. Cardiac complications, what are they? It can produce heart attack. I will tell you what the patient's symptoms are if the patient has heart attack. Secondly, the patient can have heart failure. So what is heart failure? The patient gets severe respiratory distress. Suddenly in the night, the patient was fine and his relatives or wife tells, sir, the patient was very good till 11 p.m. in the night. Suddenly at 1 o'clock, he was very restless and was telling that he cannot breathe and he has to take some support for breathing. And the patient, I know the background, has hypertension and coronary artery disease, and as a result, I have kept the patient on medical treatment only because PTCA and others also produce some sort of complications in this sort of patient. But those are not usual. Any procedure can have some small complications. But hypertensive population is a separate strata of patient. But I can tell you that don't get panic that I have hypertension. Any amount of hypertension, I have many patients whose blood pressure is 260 by 130, 140. They have severe respiratory distress when they come to me. They complain of chest pain because of very high end diastolic pressure. So they come in a very symptomatic status. But slowly, we don't get the blood pressure down all on a sudden. We go slowly and we reduce the blood pressure slowly. And what happens? From 260 by 140, we come down to 200 by 120. I can bring it down to 120 by 80. We never do it. Never ever do it. Because all the systems in our body are accustomed with that high blood pressure. So suddenly, if I reduce the blood pressure, the patient will have ischemia in brain, ischemia in heart, ischemia in the kidneys. And that will produce some adverse effects. And as a rule, the patient should completely abandon the drug therapy and he will tell, sir, I have more complications after taking your drugs. So what benefit it is going to do? And I am restarting the drugs which I have been taking and I refuse to take your drugs.
So
But fortunately, the majority of patients understand the gravity of the situation and they take the drugs as we tell, and months after months, years after years, they take the drug. But one thing I tell you, many of the patients can reduce the volume and the number of drugs they have been taking over the time. Suppose one patient is taking 4 drugs, but he can reduce it to 2 drugs or 3 drugs over the time. He doesn't require so many drugs as he was requiring initially. So this being the situation, we can make them understand that this is very vital for your well-being and you have to take the drugs. That's the doctor's responsibility, my responsibility. And associated with that, I have to tell, you have to practice good lifestyle measures that help in reducing the blood pressure. During the next few minutes, I am going to tell you, I have a patient who is a very busy person. He is a globe trotter. He is in a very responsible job. And he was very young, 24, 25 years age. And his blood pressure was 180 by 110. So I treated him. I told him he was obese, little obese. His weight was more than 80 kg. And I told him, you have to reduce the weight. So he reduced the weight. He used to exercise regularly, daily 20,000 steps like that. And naturally, his blood pressure has come down 210 by 70 millimeter of mercury, initially supported by some drugs, but now he doesn't require any drugs. And his blood pressure, you won't believe, is as low as 110 by 70 millimeter of mercury. He doesn't take any tranquilizer, he doesn't take any other drug. So he is absolutely having normal blood pressure. So in the books it is written, if you walk, your systolic pressure will get down by 3 to 6 millimeter mercury, your diastolic pressure by 1 to 2 millimeter mercury. But really, if we walk more, say 15-20,000 steps, our blood pressure will come down to by systolic pressure 15 to 20 and diastolic pressure 5 to 10 over the time. I don't claim that lifestyle modification measures like walking, only they will bring the blood pressure down to that level. But we have seen what a phenomenal effect this lifestyle measures has on reducing the blood pressure. So stick to the principle of regular exercise, whatever exercise you do, some of the yogasanas, some breathing exercises as shown, and this all put together help to reduce the blood pressure. Second most important thing, we have to reduce our weight. So if the weight is more, we are going to have more blood pressure. And increase in weight invites 13 cancers in our body. So different cancers are also more prevalent in obese individuals. So we will have to prevent obesity developing in us. So observing the weight daily is very helpful for all of us, provided it is possible. So if possible, we should keep a weighing machine in our house, and every day at a particular time in the morning, we should see the blood pressure the weight at that time. And if we can keep the weight at a normal level, our blood pressure will definitely be controlled. But even after, I know somebody will tell now that even after doing all these practices, even after exercising, even after taking less of salt in the diet, which is equally important, that if you take less of salt, your blood pressure will come down. Because cutting down the salt itself, how much? 5 grams to 6 grams of common salt. It's very difficult on an Indian diet. We take lot of dal, lot of sabji, lot of fish curry, chicken curry, etc. So everything has some sugar, and it's very difficult to keep the total salt content, not sugar, salt, not the total salt content to 5 grams per day, which contains 2.4 gram of sodium, which is the recommendation by all the health experts internationally. So we should try to keep the salt intake at the lowest possible level. But this only salt intake won't help, but it helps. It also adds the that is known as synergistic action. It is called in pharmacology as synergistic action. This lowering of the salt in the diet increases the efficiency of the blood pressure lowering drugs, that is anti-hypertensive drugs. Suppose we are giving some AC inhibitor like ramipril or ARB like telmisartan. If we give salt, cut down the salt along with that, this salt restriction will potentiate the effect of these drugs. So that's very, very important that we should restrict the amount of salt in our diet. So if we get curtailed to 5 to 6 grams of salt per day, we are sure that our blood pressure will come down, and it will also add to the action of antihypertensive drugs we have been taking. Now we have to avoid smoking and also tobacco products. So not only smoking, but also we have to avoid this guraku, and then different types of pan masala and jorda and all these things, So we have to teach them, tell them, please don't have any sort of tobacco in your daily practice or in your lifestyle, because that increases the blood pressure and also causes many other diseases like cancer. So, tobacco causes lots of types of cancer: esophageal cancer, lung cancer, stomach cancer, etc., etc., etc. And daily we are seeing it. So, we have to prevent the causation of cancer also by these methods. So, that's very, very important, because tobacco is a directly toxic thing, and in all the advisories it is written that tobacco should not be consumed. Next important is to keep the sugar level, blood sugar level at normal. It is seen that above the age of 50, 50% of the diabetic patient has high blood pressure. So diabetic patients, 50% of the diabetic patients have hypertension or high blood pressure. Similarly, 50% of the hypertensive patients above the age of 50 have diabetes, and it is sometimes treated by disease modifying factors only. Next important is lowering the cholesterol. We have to reduce the cholesterol to increase the longevity of the patient. For that we give statins, and we ask the patient to take complete rest. But suppose he doesn't take complete rest, and then the blood pressure may shoot up. At least for a few days sometimes he should take complete rest if we advise like that, because we find that the person is under severe mental duress, under severe anxiety, and sometimes we add a little anxiolytic. That only reduces the blood pressure. So these are the nitty-gritties of controlling the blood pressure, but I can assure you that if you have high blood pressure, don't panic. Take the drugs as advised by your doctor in the evening in empty stomach, say preferably 1 hour before taking the dinner, because we have nighttime surge of blood pressure, and that is prevented by taking these drugs in the night. And in more than 50% of the patients, especially in high blood pressure patient who has got target organ damage like kidney changes, the patient has, blood pressure is the commonest cause of end stage renal disease. So by lowering the salt content and by taking regular drugs, you can reduce the elevated creatinine. You can improve the eGFR of the patient. At least you can prevent the deterioration of renal function. And again, some of these drugs which we prescribe in regular prescription has some deleterious effects on the kidneys. Like rosuvastatin, we give statins for reducing the plaques, for making the plaques more stable, to prevent the heart attacks, to prevent the strokes. But in a CKD patients with high creatinine content, not borderline, rosuvastatin causes, deterioration of the kidney function by not maintaining the kidney function, the ejection fraction, and all these things. So it's very, very important that we should maintain the blood pressure at a normal level by all these means. And we have to practice. If a person who has got very high blood pressure taking the drugs, but he doesn't curtail the salt content, then his blood pressure will go up. It will not be controlled. And there are some cases of refractory blood pressure. When we call it as refractory blood pressure, refractory hypertension, when the hypertension doesn't come down, even with the addition of 3 drugs, and one of them is diuretics. Diuretics means it causes increased urinary excretion, increased urine excretion. The volume of urine increases by the diuretics. It causes sometimes also lowering of sodium and potassium, not always. And therefore we give some drugs to counteract that effect. Suppose the potassium is coming down, we give telmisartan or some other sartan, losartan with that, or some ARB like ramipril in a good dosage. That prevents lowering of potassium. So we have got various tactics, as I told you. In case of Cone syndrome, we give the patient spironolactone. Whatever drugs we give, we can give him 8 drugs, but his blood pressure will not be controlled. So we look at the electrolytes. Every patient with high blood pressure should have some tests. And you know what the test we should have, not a very big list of tests, but little, like one ECG, one echocardiogram. Also, echo is also not mandatory. One X-ray chest PA view, and one sodium, potassium, sugar, creatinine as blood test, hemoglobin, one routine urine test. So these are sufficient as a routine test. We don't need to have a very elaborative test. And we should look at the electrolytes, sodium and potassium level. As I told you, in Cone syndrome, the potassium level is very low. So unless we give spironolactone, patients with Cone syndrome, we cannot reduce the high blood pressure. And this is also very effective, this spironolactone and those group of drugs like eplerenone, which are known as MRAs, mineraloreceptor antagonists, to treat refractory hypertensive patients. As I told you, refractory means they are not responding with 3 drugs, one of them being this diuretics. Another definition is that very high blood pressure not controlled by 3 drugs, but it is controlled by 4 drugs, one of them being diuretics. So diuretics is a very constant part of this cocktail, and we use cocktail. And as I told you, we give 3 drugs put together because the patient will not take many drugs at a time. So it's very important that the drug should be given in a such a way that the patient becomes compliant. Yes, Tanya, you are having some question, I think.
Sir, sorry to interrupt you before. Just for the understanding of our patients, you mentioned the word
Yeah.
you mentioned the word ischemia. So basically, what is the meaning of ischemia? What exactly is ischemia?
Ischemia means narrowing of the arteries. Sometimes there may not be any narrowing, means plaque formation in the arteries. It may be spasm of the arteries.
Okay.
Sometimes it's a combination of both. There is some narrowing and there is some spasm, both put together. They causes ischemia. So today already I have crossed 40 minutes of talking. So I think we should restrict because of time bar. And just let me tell you the symptoms of heart attack.
Yeah.
Because we find, now also I have a patient who has come much delayed after a heart attack. What are the signs of heart attack? In heart attack, the patient complains of severe retrosternal chest pain over this area. Not like this, sir, I am getting some pricking pain. If a patient gets chest pain below the nipple, you can take it for granted. It is not cardiac pain, provided the patient is not a diabetic patient. Diabetic patients can tell any type of chest pain in a heart attack patient. And the pain is severe, excruciating. It is not relieved by nitrates given sublingually. And the pain radiates to the root of the neck, to the lower jaw, not necessarily to all the places, but it may be. And sometimes it is seen, though rarely, that the pain is only in the jaws. And the patient goes to a dentist. Then the dentist tells, no, this is not from the teeth. You are getting the pain because of heart. You are having probably a heart attack. So go to your cardiologist right now. So the patient complains of severe chest pain retrosternally. That is the commonest presentation. It can go up. It can have a root of the neck or throat, as we call it, and to the lower jaw. Sorry. Sometimes it radiates to the left shoulder. Sometimes it radiates to the back, straight over here. Rarely, though, it goes to the right shoulder. And sometimes it propagates through the hand in this way. And it doesn't go through this way. It goes through this way. So that is the peculiarity of the radiation of the pain. Secondly, it is associated with profuse sweating and shortness of breath and a sense of impending death or collapse. The patient thinks that I am going to die. And a patient who has a heart attack knows about the character of the pain, which only he or she can tell. So it's severe chest pain, associated with profuse sweating, with shortness of breath, with an impending sense of death or collapse, and the hands and extremities are icy cold. We call it as cold climate skin. Even during the winter, when we are putting shawls or coats or sweaters, the patient is sweating like anything, and it looks that we have poured 4 or 5 buckets of water on him. So this is the symptoms of ischemic heart disease at its extreme, that is with a heart attack.
Okay, sir. Now what?
Yeah, so I think today we have to end because I have a few more angioplasties to do.
Just one last question
sure.
for you, since we have entered into the month of September and this is the World Heart Month. So our viewers must be having a question for you, like what is the secret behind your healthy heart,
Yeah, that is true that we also work for 15 to 16 hours a day.
Yeah.
And over the years, even last Saturday, I have done 16 cases, 8 of them being angioplasties.
Right.
But we take care of the heart, only the things which I have mentioned to you. I don't do anything. What I preach to you, I want to practice in my life also. See, I am giving the lecture for 45 minutes after several interviews in the media, after doing a few angioplasties, and after seeing at least 20 patients since morning, and also indoor round with 30 patients. So the main thing is that you have to avoid smoking. I don't smoke. I never smoked. And what I tell you, what I preach you, I don't practice that.
Okay, sir.
And secondly, you have to keep your weight. My weight is 60.2 kg. I'm not telling because you questioned a personal question, I'm answering them. I take lots of fruits, I take almonds, I take black tea, I avoid, sugars. All white things are bad. So don't take sugars, don't take salt as I told you, I take less of salt. And also you don't take, flour, means maida, and takes more of atta, means, and that also, if possible, with some bran added to it.
Okay.
Not bran added to it, means some fibers. You take oats. And they are very good for the gut also, gut health. You take some yogurt if possible. See, now we are going through the corona phase. Again, the third phase has come, and we are seeing that the numbers of corona patients are increasing. Though we don't have corona patients in our hospital, but still we are seeing around that some of the patients are getting corona as we are coming across. And so, it's told that the best shot of immunity is by keeping a good gut health. So if you take some yogurts, you take some oats, you take some almonds, you take some onions, some garlics, and some turmeric, that's the best way. You can, some gingers, black tea with gingers, it's useful, it's very good. And you can keep your gut health very good. And there is a synchrony between the gut health and the brain also, so that you can work for long hours and less of food. See, I had my breakfast come lunch in the morning at 10 o'clock, and after that I haven't ate anything except for black coffee and black tea and some water. That's all. And I'll be going like that. So less of food. You don't have to have lot of food. You see, in those who live for long, they take less of food. But I don't tell that if you get thirsty, don't drink water. Yes, you drink water. You take tea. You take fruit juice. But we don't need lot of, food to live. At the Aurobindo Ashram, it's written that don't live for eating. Eat for living. That's very important. So we need to eat for living, just to have our livelihood going, so that we get the minimum of nutrition. We don't need lot of food. That's simple wastage. In Sweden and Scandinavian countries, they tax for wasting any food in the restaurants. So that's very important. So this simple, taking lot of fruits, vegetables in the diet, taking fish, or for vegetarians you take curds, you take cheese, because fermented food is very good. Kimchi is very good because it keeps the gut health very good. You take some brown rice, some brown atta, like that is very good, and have lot of fibers. And I check my blood pressure. My pressure is 120 by 80. My sugar is okay. My cholesterol is at its 100. So all are very, measured amount. And I have a very anxiety-free life. I am calm and quiet always after seeing so many patients. So relaxation is an art, and we have to practice it in our daily life. Even the worst of situation, worst of things happening, in the cath lab, we do such a severe, high risk job that sometimes something can happen. But we are ready to all the emergencies, all the complications, and we have to get over all the complications and make the patient walk to go home. So that's our daily. So as you told me, ask me some personal question, I answered at a personal level. And thank you very much, Tanya, for your excellent moderation and anchoring. Thank you.
Thank you so much,
Thank
sir.
you.
Thank you.